This is a public service announcement for all bedside nurses, particularly if you're a new grad. If you happen to have a patient with reduced ejection heart failure and their systolic blood pressures in the 90s and they're not symptomatic, can you please stop withholding their heart failure medications? These include medications such as ACE inhibitors, ARBs, MRAs, diuretics, beta blockers, commonly known as blood pressure lowering medications. I know it seems counterintuitive from what you're taught in school, and I know you don't want to do any harm, but trust me, if your patient's heart function is that severely impaired, it can't generate that high of a blood pressure. And any excess blood pressure it has to push against is harder for the heart. And by withholding these medications based purely on a number and not by symptoms, these patients are slowly slipping back into a more fluid overloaded state, and they are not getting better. In any case, if you're unsure and you need some reassurance, get your doctor to reassess your patient, and you can even help them out by suggesting a blood pressure parameter that works best for you and your patient. For example, if you notice that your patient's blood pressure systolic can hang around the 80s and they're not lightheaded or dizzy when they're up and walking, this is a number that you can use or suggest to your doctor to see if they're okay with it, and get a hold order to hold these heart failure medications if the systolic blood pressure drops below 80 or if they're symptomatic. Most experienced doctors who actually know how to treat heart failure will be happy that you did this, and they'll probably thank you for it. If you like these tips and you find them helpful, subscribe and say no to drugs.